We go inside your health now. So nearly half of American adults have high blood pressure. New research published by doctors at Vanderbilt University show a low salt diet can have as much effect on decreasing blood pressure as taking one new blood pressure medication. So we have our KSTP health expert, Dr. Arkel Giorgio, here now to share some of the details about this. Kind of exciting to see. So why is it? A lot of people have heard that having a low salt diet can help, but what is different about this, or why are we hearing about this now?
Yeah, so we've known this for a long time. People with high blood pressure are always told to eat a low salt diet. But here's why this study is so cool. Take a look at these results.
Okay.
So there were 213 people. They were between the ages of 50 and 75. And all of them, for a week, had their usual diet, for a week had a low salt diet, and for a week had a high salt diet. And within 1 week, their systolic blood pressure, the top number, went from an average of 125 down to 119. That's as good as a result as you can expect from taking hydrochlorothiazide, which is a typical blood pressure medication. That is cool.
That is
In 1
really
week.
cool. Now, how much salt is there in a low salt diet? To get those kind of amazing results, how much salt are we talking about?
So we're going to compare it to a usual diet, and our usual diet is too much. So our usual diet has about 4.6 grams of sodium in it. That's about 2 teaspoons. The low salt diet that they were using in this study was about 3/4 of a teaspoon, the equivalent of 3/4 of a teaspoon of salt. Now, a lot of people could say, but that tastes horrible. Here's what's also cool about this study. It is that all of diet that they put these people on, everything they got from the grocery store. And they published it, and it's available, and I was looking at it. It had everything from, of course, fruits and vegetables to chicken, but it also had tortilla chips, it had yogurt, it had some frozen meals that were low sodium. So this is achievable.
And okay, they looked at people who had high blood pressure and people who didn't have high blood pressure in this study, right? We can probably all stand to cut down on our salt, couldn't we?
Absolutely. And because we all are starting out with a high salt diet, which isn't doing our hearts and our kidneys any good. And so they showed that there was a reduction in systolic blood pressure even in people who started with normal blood pressure. And you could say, well, are there any adverse effects of that? They were minimal. And just as many people had some mild effects from lower blood pressure as they did when they had a high salt diet. So it really, the complications were trivial, and so eating a low salt diet could put someone in a range where they're not going to creep up into that high blood pressure range.
It'll keep you in that healthy range.
Exactly.
Suppose, I've heard from people who've done this, who've said it's been really helpful, more so than medication, or makes them feel better probably overall than the medication.
Right. Have you ever had high salt and your rings get all...
Right, your hands get kind of puffy.
Right.
What's your overall takeaway then? What can everybody watching do for their own diet, and how can that impact their...
Well, I think that most everyone can benefit from looking at how much sodium they're taking in their diet, even if you can't get all the way down to 3/4 of a teaspoon a day. Just like counting steps matters and a few steps is better than nothing, lowering your salt is better than nothing. It's possible, if you already have high blood pressure, that lowering your salt could take one of those medications off your list of medications that you have to take. So all good news.
And it's good news. Arkel, thank you so much for bringing this to us. We appreciate it.